When your to-do list is piling up and you feel like you're going to scream, it's okay to take a break. This is the Health and Wellness Show, brought to you by Hauser's Pharmacy and Home Healthcare on 900 CHML.
On the Health and Wellness Show, we're going to talk about something that people suffer with, but they aren't quite sure exactly what it is. It may be a persistent ringing in their ears. It could be some other sounds. It could be, depending on which way you want to say it, tinnitus or tinnitus. And joining us to talk about this for a few minutes is the Director of Audiology at Hearing Solutions, Andreas Seelisch. Andreas, first of all, thank you for joining us. And let's clarify, you can say it either way, right? Tinnitus or tinnitus?
Hi, Ted. Absolutely. Both tinnitus and tinnitus are considered acceptable.
All right. So let's talk about this now, first of all, because sometimes people equate it to when they go to a loud concert and they have the ringing in their ears, but it lasts longer, obviously, than just going to a concert and having it stay with you for several hours. So actually, first things first, we should talk about what it is and then kind of all the other things after that.
You bet. So you've touched actually on a nice point. So a lot of people will experience tinnitus at some point in their life, but there's a big difference between people who have a temporary form of tinnitus and people who have a chronic form of tinnitus. So you can have it for a lot of reasons, and like going to a loud concert or being exposed to noise is a very good example of where somebody will have it temporarily. It's usually an indication that you were exposed to too much noise and likely there's a little bit of damage that could occur. Fortunately, our bodies are resilient, and so for most people it goes away again and they don't have to worry about it. Unfortunately, some people have it persistently, and for those people who have chronic tinnitus, it can really be a burden on them and bother them quite a bit.
Well, let's go ahead, Andres. Sorry, go ahead.
I just wanted to answer the other question. People are asking, like, where does it come from or what is it? I mean, tinnitus is a symptom. It's not a disease itself, and so it's typically being caused by something else. And for different people, it could be caused by different things. And some people, it's a medication can cause it, or jaw impingement on a nerve. But for an overwhelming number of people, there's an underlying hearing loss, and that's what caused it for many people.
You know, it's interesting you mention, because a lot of people grind their teeth. It's interesting that you talk about the correlation between somebody grinding their teeth and tinnitus. Kind of talk about that, because I find that fascinating.
Yeah, definitely. For some people, it can be the actual impingement of the jaw itself, and so inflammation in there is causing it. And for those people, best course is to see a dentist. The other thing, however, though, that's linked with tinnitus is stress. And so for some people, grinding can be a symptom of stress, and so there can be a linkage there as well.
You know, one of the things that I do on this program is I share stories of stuff that's happened to me, and listeners are probably going to find out something for the first time that I was diagnosed with this particular thing several years ago. When it first happened, I got to tell you, Andreas, it sounded almost like when you put a steak on a barbecue and it was kind of hissing in the background, and then it kind of got worse than that. Talk about the mental strain of this, because when it first happened to me, I thought, there's no way that I can keep on going, because it was really, really overbearing.
Absolutely. And so it can be a real burden for some people, and it's really variable how it reacts with different people. Some people will notice at the onset that, it's really bothering them a lot and they don't know how they're going to be able to take it. And over time, they're able to adapt and habituate, and it sort of falls into the background. And it might not disappear. It's not like it's gone, but they've learned to cope with it and manage with it, and it's no longer a big burden on their life. And another thing that's very variable is, as you mentioned, the perception of the tinnitus. For you described it as like a sizzling steak on a barbecue. For some people, it's more classical bell ringing kind of thing, or a whistle. There's a whole variety of different perceptions of how people hear this symptom, or this buzzing or ringing, or however they experience it.
Has there been any sort of scientific correlation between seasonal allergies, when people's noses get plugged up and their ears get plugged up, and tinnitus, or are the two entirely not related?
There's not as strong linkages with that, but I will say that, there is a connection in that sinus involvement is connected to our ears through our eustachian tube. So there's a tube that joins your throat to your middle ear behind the eardrum. And so it is possible that if you're having inflammation and interaction that way, that you could have a linkage in that case too, even if it's not one of the more classical presentations.
Now, you talk about stress. I'm wondering now, and I think I know the answer to this, Andreas, but these days with COVID-19, it causes a lot of stress for everybody, and it manifests itself in different ways. Talk about the correlation between stress, anxiety, COVID-19, and tinnitus.
Totally. I mean, you've said it, there's lots of stress going around. People are worried for themselves, for their job. They're dealing with burnout and health concerns. So lots going on. One of the more well-documented connections is between stress and tinnitus. And it's not so much that stress causes tinnitus, but it's known to aggravate it. So somebody who has maybe a little bit of baseline tinnitus and is now dealing with stress on top of it can find that their tinnitus symptoms are aggravated or really more noticeable than they were before. And we're certainly seeing more calls in our clinics for people with these tinnitus concerns. The problem with that is it could be a self-perpetuating cycle. We have increased stress, which gives us more tinnitus, and then you have more tinnitus, which gives you another thing to stress and worry about, and the two can fuel one another. And one of the concerns that I have is that another one of the well-known links between tinnitus is with fatigue and sleep deprivation, that some people find it's hard to fall asleep with, and they have this persistent noise in their ear, and so then they get fatigued. Fatigue can aggravate the symptoms as well, so then the ringing is worse, and they have even a harder time falling asleep, and then we have this, again, another cycle that fuels upon itself. And so this is one of the concerns right now with increased stress going around, that some people's symptoms may be getting worse.
Our guest on the Health and Wellness Show is the Director of Audiology at Hearing Solutions, Andreas Seelisch, talking about tinnitus, or the other word, the other way people can say it is tinnitus. I'm wondering now, because you mentioned that it's not a disease but a symptom. So, simplistic question here, can the symptom be cured and eradicated?
It's a great question, and it's one that gets asked all the time. I wish there was like a magic bullet that could just simply make it go away. Unfortunately, it's not such an easy thing to just cure, and you'll sometimes see, promises of these things, but there's not a lot of evidence to just make it vanish and go away. That being said, that's not a very good message to people. It's a hopeless message, and it's not the end of the story. There's lots that we can do about our tinnitus, even if we can't make it simply vanish. And one of the really helpful things for people is being able to take control of what's happening to them. For a lot of people, having a better understanding of what they're experiencing can be therapeutic in itself. And so for a lot of people, what they really need is just a consult. They need to understand what's going on, understand the cause of it, and taking control back can really put them in a better place, because it takes it from having this unknown that's going on to something that you're aware of, and it's not as much of a bother. And so a lot of people who can go through that process will say, you know what, I still notice that it's there. Now that you mention it, I notice it's in the background, but you know what, it's not something that bothers me anymore. And there's a big distinction between, being chronically bothered by the symptom or having it just sort of back in the background.
So I guess the question now becomes, what comes first, hearing loss and then tinnitus, or tinnitus can cause hearing loss, or are the two just kind of side by side?
They're likely developing at the same time, but it's not so much that the tinnitus is causing hearing loss. A lot of people will find that they feel that they're maybe not hearing as well because the tinnitus symptoms are distracting them. But in most cases, the hearing loss is developing behind the scenes, whether people are realizing it or not. And then the tinnitus is a way our brain is reacting to that. You can kind of think of it as, getting a message to your brain, and it's not getting all the information it's supposed to, so it kind of tells your brain to turn up the volume in that area, and it's turning the volume up in an area where there's maybe nothing going on there. It's an increased response from our brain. So for most people, the hearing loss is happening, and then the symptom tinnitus is following afterwards.
I'm wondering, though, when people go, for example, a hearing test, and people go through it, and they do those tests where they hear the ringing and what have you, could those test numbers, if you will, be almost skewed because they think they hear the sound on the headphones, but it could be the tinnitus or vice versa?
It's a great question, actually. Part of the testing that we do, and at least what we do in our clinics, is we're separating those two tests. We're separating the test to see how sensitive the hearing is at different pitches or frequencies. And then we're also doing additional tests where we can match that to the tinnitus symptom in terms of the magnitude, how loud you're perceiving it, and at what pitches it's happening at. So we're quite sensitive at being able to separate the two.
Before we wrap up, you talked about trying to kind of calm things down if somebody is suffering from this. Self-care, as you mentioned, is probably number one. And you mentioned that getting sleep these days. I know it's tough because everybody's worried about COVID and the aftermath of that. But self-care, getting a lot of sleep is one of the most important things for this.
You bet. So anything you can do in terms of self-care to reduce stress is a good thing. I know that's easier said than done, but whether it's, getting your exercise in or finding some other way to decompress, that's definitely helpful. On the topic of sleep, you can do a little bit of sound enrichment. What that is having other sounds in the environment will help distract your brain from the sound that's always there. So a fan or a fountain or something in the background is often helpful for a number of people. And that's true any of the time. So when we enrich our acoustic environment and we just have other sounds present, our brain is usually more interested in that, and that can not only distract your brain from the tinnitus, but it can also train your brain to get better at redirecting its focus. And that's actually one of the treatment strategies for people who are dealing with chronic tinnitus, and they need to do something above and beyond just the education aspect. Masking or sound enrichment is a big part of the therapy as well. And we have many happy patients who have been treated that way too.
Now, I know that the term white noise has been talked about by people, but I know when I was first diagnosed and I kind of put on the sound of the calming waterfalls, it made me think that I was in, South America somewhere in a rainforest. Do those types of things, do you encourage people to maybe use that to kind of block out what they think they hear?
Yeah, I mean, things like that. You can download apps that do that sort of thing as well, work really well. Water, so like rushing waves or a babbling brook tends to be a good example because there's a lot of energy at a lot of pitches or frequencies. And so they tend to be very good masking signals, and they tend to be sounds that we don't find obtrusive, like they're relaxing in their own way. And so it's kind of a two-pronged approach. It's a little bit relaxing. It's a good sound for covering up a wide variety of sounds, and so they're a good distractor in that sense, and so it can be very, very effective.
Before we wrap up, let's talk about if people wanted to get more information about tinnitus, they have some concerns, maybe they want to talk to members of your staff. How can they do that?
We have 2 clinics in the Hamilton region. We have one in the Lime Ridge Mall and another one in the Eastgate. Those are the great places to go. You can find us online at hearingsolutions.ca as well, and we'd be happy to give people a consult and give them some education in this area.
Andreas Seelisch, Director of Audiology at Hearing Solutions, thank you very much for the time, a topic that perhaps people haven't thought about, and hopefully we be able to give them some sort of education on that. Thanks very much for the time. Appreciate it.
Thanks for having me on the show, Ted.
The Health and Wellness Show brought to you by Hauser's Pharmacy and Home Health Care, conveniently located on the mountain at 1010 Upper Wentworth Street, across from Lime Ridge Mall.